Hello, my name is Olivia Staples. I'm a nursing student here at the University of South Alabama, and today I'll be performing the medication administration checkoff. She's going to scan the room. So the first thing I'm going to do is make sure I'm in a no interruption zone. So I'm going to make sure the door is closed to the medication room. I'm going to not be answering any phone calls, and I will be limiting my communication with my colleagues. So then I'm going to verify the medication order to the patient order form to that on the MAR, and I'm going to do this using the 5 right. So I'm going to check the right patient, right drug, right amount, right route, and right time. So I notice his name is Jaguar Jones. He's going to be receiving heparin, 5,000 units, subcutaneously, every 12 hours. And I'm also going to make sure his allergy is written on his MAR, and he is allergic to penicillin, and it is documented on the MAR. So now I'm going to perform hand hygiene, and I will select the correct medication, which is heparin. And I'm going to check this with the MAR sheet. So he's given heparin. I noticed that the drug is not expires, it expires in 2025. It's supposed to be given every 12 hours. It has not been given in 12 hours, so that's why we're going to be administering it now. And I would also, it is given subcutaneously, so I'm going to check, I'm going to be using the TB syringe. So before I begin, I'm going to calculate the correct amount, and I notice on the vial it is given in 10,000 units per milliliters, but on the order it is for 5,000 units, therefore I know it's going to be 0.5 milliliters. So first, I'm going to clean the vial with an alcohol swab. And I'm going to get my syringe. And I'm going to pull in about 0.5 milliliters of air. I'm going to take the cap off, set to the side, put it in the vial, release the air, and then I'm going to pull the syringe back and pull the medicine into the syringe. I'm going to pour get a little more than 0.05. Tap it, make sure there's no bubbles in it. Then I'm going to release it to 0.5. Then I'm going to cap it using the sweep method. Now I'm going to check this on the MAR. And I notice heparin is given 5,000 units or 0.5 milliliters, and I would normally have a nurse help me check my calculations if indicated to do so. So now I'm going to perform the second check of accuracy. I'm using the 5 rights. I'm going to check the patient's name, the correct drug, the correct amount, the correct route, and the correct time. So notice the patient is Jaguar Jones, and he's going to be given heparin, 5,000 units or 0.5 milliliters subcutaneously, so we're going to be using the TB syringe every 12 hours, and he's not been administered medicine in 12 hours, that's why we are administering it now. And now I'm going to create a label. And on this label, I'm going to write the patient's name, Jaguar Jones. I'm going to write his drug, heparin, and the amount, 0.5 milliliters. And then I'm also going to initial it. I'm going to write this in the syringe. Alright, so now I'm going to take my syringe and my MAR form into the patient's room. And before entering the patient's room, I'm going to use hand hygiene. And I'm going to identify the patient using 2 identifiers. I'm going to use my MAR and his band. And I notice his name is Jaguar Jones. Jaguar Jones, he was born on August 25th, 1963. August 25th, 1963, and I noticed he is allergic to penicillin. He's allergic to penicillin, so I would then ask the patient about his allergies and how he reacts to those, and I would perform any necessary pre-administration assessments for that specific medication. And now I am going to perform my third step of accuracy, check of accuracy, again using the 5 rights: the correct name, correct drug, correct amount, correct route, and the correct time. So his name is Jaguar Jones. He's going to be receiving heparin, 5,000 units, 0.5 milliliters, subcutaneously with the TB injection every 12 hours, and he has not been administered his medicine in 12 hours, so we will be administering that now. And next, I'm going to explain the procedure to the patient, making sure he's just aware of when I'm going to be given the medicine. And then I'm going to raise the bed, lower the handrails, and then I'm going to apply my gloves. And my other glove. And my goggles. Now I'm going to show the patient where I'm going to be giving this injection. This is going to be on the abdominal area, and I'm going to be clear, stay clear of the 2-inch border around the umbilicus, and I'm going to make sure I don't go below the pubic area or above the intercostal margin, and I want to stay, I don't want to go past the anterior superior iliac spine. Now I am going to be checking the skin for if there's any skin integrity, as well as if there's any bruising. Now I am going to be cleaning the area, so I'm going to take my alcohol swab, and I'm going to use circular motions to clean the area. Now I'm going to have this just use a point to face the area that I just cleaned. And now I'm going to uncap my syringe, discard it into the shard box, and now I'm going to pinch the skin, and because I can pinch about 2 inches of tissue, I'm going to go in at a 90-degree angle, and then I am going to inject the medicine, and I'm going to do this and apply pressure. And so now I'm going to position the patient comfortably. I'm going to lower the bed and raise the handrails, and now I'm going to take off my gloves and perform hand hygiene. And then I'm going to assess and make sure that he has not had an allergic reaction to it. And then I'm going to document how the patient tolerated the procedure, which is the 6th right. And then I will come back later just to see how the patient tolerated the procedure and if they have had any allergic reactions. That's it. Thank you.